Hello, I'm Arlene Fiore, one of the HAYCAST PIs, and on behalf of my co-I, Pat Kinney, and our entire investigator project team, we'd like to thank you for taking the time to learn a little bit about what we've been working on over the last few years. And so before launching into our project, I want to acknowledge our team and point out especially our stakeholder partners from New York State Department of Environmental Conservation, New York State Department of Health, as well as the US EPA in both the Office of Air Quality Planning and Standards, as well as the Office of Research and Development. What I'm showing you here is a map of annual mean surface fine particles, or PM2.5, for the year 2013 that was derived by fusing together multiple satellite aerosol optical depth products, models, and surface measurements. This approach to estimating PM2.5 was pioneered by Randall Martin and his group then at Dalhousie University. And these kinds of data sets have been instrumental in raising awareness of the global health burden associated with exposure to ambient fine particles. And these products are also being widely adopted in epidemiology. However, in epidemiological studies, the typical approach involves selecting a single product, and it's not very clear from those studies what some of the uncertainties are in the choice of product. And so that was becoming clear from questions that we were getting from our stakeholder partners and led us to propose our investigator project focused on New York State, in part because that's where our stakeholders were, and also because we have a wealth of information available there in terms of evaluating uncertainties in PM2.5 all along the steps that are involved in going from what's observed from space, which is the light extinction in a column due to the presence of particles or aerosols, to what we care about from a health perspective, which is the fine particle concentrations that are being breathed in at surface level. And so for the first part of my talk, I will focus here on the key uncertainties in satellite-based mapping of PM2.5, and we'll also look at differences across products available for PM2.5 over New York State that are derived from satellite, but also using models, as well as if we stuck just with the ground-based observations available. So here, our approach is to use satellite AOD following a simple version of the approach pioneered in the Dalhousie group. And for our project, we used the Modus MIAC product at 1 kilometer, combined with simulations from the Community Multiscale Air Quality Model, or CMAQ, that's run by our New York State DEC collaborators. And so from the model, we get the fine PM2.5 and its relationship with column AOD. However, we actually calculated AOD offline using a radiative transfer code that ingests the different concentrations of fine particles. And then in the end, we derive a map across the broader Northeast shown here for fine particulates at the surface. And so what we want to do next is to evaluate the different products. And so for column aerosol optical depth, we turn to the AeroNet sun photometers, among other data sets. Those are shown here in the circles. And with the radiative transfer model, we can explore sensitivity to different microphysical parameters. And at the surface, we have ground-based monitors that can be used to evaluate the satellite-derived products. So one of the key findings, and I want to emphasize that this work was led by former graduate student Xiaomeng Jin, who just defended a few weeks ago. And what Xiaomeng did was to say, okay, well, I can calculate how much my derived PM2.5 from space would change if instead of using the satellite AOD, I use the AOD retrieved from the sun photometer network. And similarly, I can also estimate how much that PM2.5 would change if instead of using the model surface to column relationships, I use an observed surface to column relationship that can be obtained by pairing AirNet and AQS sites that are within 10 kilometers. And we found 11 such incidences of that for the northeastern US. The results are shown here, which shows the change in PM2.5 from the green approach or the blue approach by month. And what we see is that the change in PM2.5 for every month is generally larger if we use the observed surface to column relationship as compared to the differences that we get if we use the AeroNet AOD instead of the satellite AOD. And so that led us to conclude that at the daily scale, and I should note that we were kind of pushing the envelope here by trying to derive satellite-based surface PM2.5 at the daily scale, that there's more uncertainty coming in from the modeled PM2.5 to AOD relationship. And so this and some of the other evaluations that are written up in Xiaomeng's atmospheric chemistry and physics paper are now being used by colleagues at EPA to evaluate their regulatory model, CMAQ. In a different analysis published in Environmental Research Letters, Xiaomeng compared 7 publicly available PM2.5 data sets for New York State. And what I'm showing here are the maps for 2002. And what might be jumping out at you is that the colors and the spatial distributions look pretty different across these different estimates for surface PM2.5. And indeed, there's a 6 microgram per meter cubed range in population weighted annual mean PM2.5 across these data sets. However, one robust finding across all of the data sets is that when we compared trends from 2002 to 2012, all of these products indicate that PM2.5 over that decade decreased by between 4 and 5 micrograms per meter cubed. However, you may still be wondering which product is most accurate. And so to try to get some answers to that question, Xiaomeng found 2 different data sets of independent measurements. And when I say independent, I mean that they weren't ingested or used in the training or bias correcting of any of the products on the previous slide. And those include 2 sites shown in stars here in upstate New York, as well as the green stars here from the New York City Community Air Survey Monitoring Network. There's a lot of detail in these different observations that I'm glossing over here, but just to give you a qualitative summary of an example comparison between 2 data sets. This is the Dalhousie product, a geophysical approach that uses the model surface to column relationships that I stepped through in earlier slides. And this is a statistical model, in this case using machine learning, that was developed by Haycast PI Yang Liu at Emory. And so perhaps not surprising, the geophysical approach seems to do a bit of a better job when you're further away from the ground-based monitors that are used to train the statistical model. However, the statistical approach has the advantage of higher spatial and temporal resolution, which are the aspects that led our New York State Department of Health collaborators to select the Emory product for use in their ongoing studies of birth defects and health disparities in asthma. In addition, Xiaomeng's paper, and particularly this point about the need for independent measurements to evaluate different PM2.5 products with, has been cited in a recent US EPA policy document. So coming back to our overview slide here, I want to switch gears a little bit now and focus on the health endpoint aspects of our project. And the key question here is still focused on uncertainty in PM2.5 exposure, but now trying to quantify the impacts that this uncertainty has on health studies. And so the first study is a health impact assessment that was published as part of Xiaomeng Jin's environmental research paper last year. And what she did is to take these 7 available data sets for New York State that I had previously shown you, but now combine them with integrated exposure response functions from using global burden of disease methods out of the Burnett et al. 2014 paper that developed these integrated exposure response functions from a meta-analysis of several individual epidemiological studies. And so what Xiaomeng found is that as we march through time here, we see the decline in PM2.5 across all these products, leading to a decrease in the mortality burden. So there are lives saved every year as we go through, such that by 2012, there are over 5,000 lives saved in 2012 due to lower exposures to PM2.5 as compared to 2002. Another key aspect of Xiaomeng's study is this comparison of the uncertainty in the health responses associated with the differences across the 7 PM2.5 data sets versus those associated with the relative risks in the epidemiological studies. And so while this is tempting then to conclude that the differences across these 7 data sets maybe are far less important than the uncertainty coming in from the health side, it's important to keep in mind that those relative risks are derived from epidemiology studies, each of which has selected different exposure estimates. And so we were interested to understand how much uncertainty in those exposure estimates affects epidemiological studies. And so Mike Key at the Mailman School of Public Health at Columbia University did just that and conducted an epidemiological study in which he uses 5 daily PM2.5 exposure data sets available over New York State. What I wanted to first point out is that the county level cardiovascular and respiratory hospital admissions, but cardiovascular is shown here, are available at the county level each day. If we were to restrict the study to counties only where the ground-based monitors are available in the air quality system, then we would only be using 18 out of 62 total New York counties. But by bringing in, for instance, satellite-derived products, such as the Emory one shown here, statewide health studies become possible. And so Mike used traditional epidemiological methods to analyze these data sets and find that there are robust adverse associations between the percent increase in cardiovascular hospital admissions per 10 microgram per meter cubed increase in PM2.5, regardless of whether we use the model-only data set, the model OBS-Fuse data sets, or 2 different satellite-derived data sets that we have available daily at the county level for New York State. However, what Mike also finds is that there's nearly a factor of 4 difference in the health impact response that's diagnosed depending on the exposure data set. And so we interpret this as indicating a real need for epidemiological studies to consider differences across exposure data sets, and even more important is having independent measurements that enable us to assess which of these exposure data sets is most accurate. And so before signing off here, I just wanted to note that I've shown you highlights from our PM-focused investigator project, but we also had some work focused on improving our understanding of both background and locally produced ozone with the intent of informing ozone NAC's implementation. And so I'll close by just pointing out that we do have a poster focused on drought signals detectable in the OMI Aura satellite products that I hope you'll check out. And I want to thank you very much for your time. And also, if you have any questions, our team would be more than happy to have you reach out to us. Thank you.